this is the first AI platform that will allow independence for individuals with intellectual and developmental disabilities. I want to start not with data, but with a story. A few years ago, while I was a consultant at Deloitte, working with the Massachusetts Department of Developmental Disabilities, I had the opportunity to listen to a woman named Donna J. speak. You see, Donna was dependent on others for the most part of her adult life, and they helped her with her daily living. Then Massachusetts expanded its self-directed services under the Real Lives Law. That's a policy that allows individuals with intellectual and developmental disabilities to direct their own care and design their own lives. That changed everything for Donna. She moved into her own apartment. She designed her own schedule. She lived, not just was cared for. She said simply, I just wanted to live my own life. I left the room thinking about thousands of people like her who never get that moment. Not because they can't live independently, but because the system doesn't give them the tools to try. And that's why I built IndeLiv AI. People like Donna are not an exception. They are the rule. The IDD care system is at a breaking point. The data shows for itself. There's 37% of annual DSP turnover, 69% providers turning away new referrals, and 75% of adults with IDD who live with aging caregivers. And less than 5% use any type of assistive technology, despite decades of evidence that it works. This is not a clinical problem. This is an infrastructure problem. And IndeLiv AI exists to change that. Our mission, a world where every person with IDD lives with the autonomy, dignity, and community they deserve, supported by technology that adapts to them, not the other way around. IndeLiv AI is an adaptive AI companion built on 4 pillars: medication prompting, hygiene and active daily sequencing, community integration, and caregiver intelligence dashboard. The panel in the middle is an example of a voice companion. Think about what this looks like in practice. Every morning, the individual is greeted by the platform, by name. It guides them step by step through their daily activities, and in the modality of their choice, whether it's voice, visual, or haptic. It learns their patterns. This is a $104.6 billion total market and a serviceable market of $70.3 billion. IndeLiv AI's 5-year target is $94 million. No one has built this before. There are other players like Central Reach who are purely in billing and EHR. Simply Home is focused on aging for adults, and Kibu is in telehealth. 3 sources of revenue: B2B SaaS to provider agencies, Medicaid waiver, and family direct pay. We are pre-revenue, and we are not pretending. But there's signals and there's appetite after conversations, informal conversations with providers. I am the person who built this from the inside. 15 years of healthcare strategy experience at Deloitte, Massachusetts Department of Developmental Services, and Yale School of Management. I know what the system works, how it works from the inside.
Thank you so much. We're going to move into the judges' questions now.
Thank you very much. Obviously, when you're moving into this sector, it's very competitive. And there are a lot of very big companies, extremely well funded. And devices like Aura can migrate into this. So what's your plan? What's your differentiation, truly your differentiation that says Aura can't win this market?
Sure. Thank you for the question. Well, Aura can't win this market because Aura has been around for more than 3 or 4 years. I will not say definitively that it cannot win, but why we are positioned better than Aura is because generative AI over the last 3 years is more reliable now. It's going to get better, but it's reliable now than 2 or 3 years ago. And that's why we are better positioned than bigger companies like Aura or other players who are already in the market.
But what data do you have that says that what you've done pushes Aura out?
Sure. In terms of data, we don't have Aura because that's not a device, and we are also piggybacking off of existing device like an iPhone or an iPad or an Apple Watch if the individuals prefer. And Aura is a device that still needs further exploration if individuals with intellectual and developmental disabilities can use them effectively. So this is less reliant on more and more devices than just simply use what's already out there, like an iPhone, an Apple Watch. Apple Watch is nice to have, but an iPhone or an iPad, which individuals are already using.
Thank you.
Thank you for this. There's a wide range of disabilities that people may have, and it seems like somebody would have to be functioning at a relatively higher level to engage in this kind of technology. How's it decided which patients are appropriate for this?
Yeah, thank you for the question. 2 parts. We are in the process of hiring a clinical advisor who's going to help us design in a person-centered format. And then the other question, Donna J., the individual I was giving you an example, she's legally blind. So, and still she was able to live on her own. We will be working with the existing providers, their care groups, their families, to help them gradually move to an independent setting if that's what they choose. There is a range, as you said. There is a whole spectrum of intellectual disabilities that people can have. This is up to them on whether they want to use it in the group home provider setting or in their homes where they're cared for by elderly parents, or ultimately they want to move outside. But we will not label or give a cutoff as to who can use and who cannot use. We will not be doing that.